Welcome, friend. If you're a man over 30 and you've ever caught yourself wondering, is my size normal? And how do I even measure it the right way? You're in the perfect place. Today we'll cut through the internet noise and replace anxiety with clarity. You'll learn what normal really means, how to measure length and girth accurately, what the science says about averages, and which choices actually improve confidence, performance, and health as you age. Stay with me. By the end, you'll feel informed, grounded, and motivated. First, a breath of relief. Most men who worry about size are well within the medically normal range. The problem isn't your body, it's the lens you use to judge it. Camera angles, selective casting in adult media, and constant comparison distort reality. That stops here. We're going to measure like clinicians do so your numbers are real, not guesswork. How to measure length correctly, the clinical way. Use a firm ruler or measuring tape. Stand or lie comfortably. Press the zero end gently into the fat pad until you reach the pubic bone. This is important because fat at the base can hide length. Keep the ruler along the top of the shaft and measure to the tip of the glans. You can do this when erect or flaccid and stretched. Gently pull straight, don't yank. Clinicians often prefer the flaccid stretched length because it correlates closely with erect length. How to measure girth, circumference? Take a soft tape or a piece of string that you later lay against a ruler and wrap it once around the mid shaft, not at the base, not at the tip. Record the number where it meets. Do it erect for the most useful comparison and write it down. If you're tracking changes over time, measure at the same points, length and girth, under similar conditions so your data stays consistent. 3 pro tips older men miss. 1. Always measure from the pubic bone, not the skin. 2. Keep the ruler on top. Measuring from underneath adds illusory length. 3. If you carry extra weight, the fat pad can visually reduce apparent length. Losing a few inches off the waist often gives back visible length without touching the anatomy at all. Before we dive into averages, remember this. Size is only one piece of sexual wellness for men 50 plus. Blood pressure, vascular health, pelvic floor strength, sleep, and medications all influence erection quality and satisfaction. A number on a ruler never tells the whole story, and partners consistently report that intimacy, confidence, and communication matter far more than centimeters. If you're curious about gentle, non-pharma ways to support circulation and performance, look for a science-informed option in the top comment that helps your body generate more nitric oxide. No. It works by using concentrated dietary nitrates that convert into NO, adds key amino acids to maintain steady levels, and includes natural antioxidants that support nitric oxide synthase, the enzyme your body uses to create NO. Many men also report clearer focus and healthier feeling vessels. If that sounds useful for you, tap the link in the comments to learn more and decide for yourself. Now, what counts as normal? The largest meta-analysis to date pulled data from tens of studies and nearly 15,000 men worldwide. Combining many carefully measured samples gives us reliable averages and practical ranges. For length, when measured erect or flaccid and stretched, most men fall roughly between 10 and 16 cm, about 4 to 6.3 inches. The global average sits around just over 5 inches. On the extremes, an erect or stretched length under 7.5 centimeters, about 3 inches, is medically defined as micropenis. The truly large end above 0.24 centimeter, 9.5 inches, is exceedingly rare. These are statistical outliers. Read those numbers again and breathe. If you're in these ranges, you're squarely among the vast majority. And if you're outside them, it still doesn't define your masculinity, desirability, or ability to satisfy a partner. In fact, mid-range sizes tend to be the most comfortable for many couples. What partners value most, especially in long-term relationships, are arousal, connection, foreplay, and technique. Those are learnable. Those improve with age and practice. Practical measurement checklist you can save. Measure length from the pubic bone to the glans tip. Measure girth at mid-shaft. Record erect values. Repeat under similar conditions. Track waist reduction if you're losing weight. And never compare your flaccid size with someone else's erect size, a common mental trap. Keep your numbers private if you like. This is about your health, not a scoreboard. Before we move on, do me and other men a favor. If you're finding this level-headed approach refreshing, hit like so more men can see it, drop a comment with what confused you most before today, and subscribe for the full series on men's health after 50. Your engagement tells the algorithm to put balanced, judgment-free content in front of guys who need it. Let's round out the science with girth. Circumference varies more than length from man to man, and that's one reason partners often describe comfort and pleasure as a spectrum rather than a single number. When measured erect at midshaft, many men cluster between about 10 and 13 cm, roughly 3.9 to 5.1 inches, with an average near 11.5 cm, 4.5 inches. Flaccid and stretched girth tends to be lower, around 8 to 10.5 cm. Remember, compare like to like, erect values to erect values. Mythbusters older men should know. 1. Growers versus showers is real. A small-looking, flaccid penis can expand substantially when erect, and the reverse can also be true. 2. Cold, stress, and anxiety can temporarily shrink flaccid size. 3. Porn is entertainment, not a measuring standard. Selective casting and camera tricks exaggerate perception. 4. Partners report that arousal, foreplay, communication, and rhythm matter far more than raw dimensions. Mindset check. If you constantly judge yourself from a top-down angle in the mirror, you'll seem smaller than you are. Cameras and other people see you from the front. Measure clinically, then focus on function, erection quality, stamina, and shared pleasure. Those are the wins that change relationships. Practical health levers for men, 50 plus. Waistline. Trimming the fat pad at the base can restore visible length and improve testosterone and insulin sensitivity. Blood pressure and lipids. Manage with your clinician. Healthy vessels equal better inflow and better rigidity. Pelvic floor training, brief daily Kegel routines, squeeze-release cycles, improve control and can intensify climax. Start gently, avoid constant clenching. Walking and resistance work, even 20-30 minutes of brisk walking plus simple strength moves, squats, rows, presses, boosts circulation and mood. Sleep, 7 to 8 quality hours, stabilize hormones tied to libido and morning erections. Alcohol and nicotine, both blunt vascular responsiveness. Less is more for performance. Diet. Nitrate-rich foods, beets, arugula, spinach, colorful produce, omega-3s, and adequate hydration support vessel health. Supplements? Approach as a supportive add-on, not a magic wand. Many men over 50 use L-citrulline or L-arginine to support nitric oxide production, sometimes with antioxidants. Some feel a difference, some do not. If you're on blood pressure meds, nitrates, or have cardiovascular disease, talk to your clinician first. Let's put averages in perspective. A large majority of men fall into a mid-range for both length and girth. Meanwhile, surveys consistently show that far fewer partners rank size as a top priority compared with how many men worry about it. In long-term relationships, generosity, attentiveness, and confidence carry the day. Technique, pace, angles, pressure, rhythm can be learned and refined at any age. If you want a skill that reliably improves satisfaction, learn to slow down. Longer arousal increases blood flow, boosts natural lubrication, and improves erection quality without changing a single millimeter of size. Measurement pitfalls to avoid. Don't compare your flaccid state to someone's edited, fully erect image online. Don't pull the ruler from underneath or from the skin level. Don't remeasure daily. Your body fluctuates. Pick one day per month, same time, same conditions, and record it. Treat this like blood pressure, a data point, not a judgment. Confidence builders that actually work: clean, well lit environment, slow breathing to tame performance anxiety, a warm shower to encourage natural vasodilation, generous foreplay, and open communication. Tell me what feels best. These simple moves matter more than any extra half inch. If this is useful, please tap like so more men can find it. Drop a question you want answered in the next episode: measuring curvature, morning versus evening differences, or how pelvic floor training fits into your week. And if this channel helps you stay informed after 50, consider becoming a sponsor to keep it ad light and science first. Even a small monthly membership or a one-time thanks tip goes straight into producing practical content men can trust. Now, what about medical procedures? It's smart to understand what's out there before you see an ad and book something you might regret. Most cosmetic offerings fall into two buckets: increasing girth and increasing visible length. They're not equal in safety, predictability, or permanence, and none of them change erect length dramatically. Your best investment is still health, technique, and confidence. Procedures should be considered cautiously, ideally only after a frank discussion with a urology professional who can outline risks and benefits for your specific situation. Positions and comfort hacks: bookmark this. Side lying positions reduce weight on wrists and back and can make penetration angles gentler. Using a wedge pillow or folded towel under the hips can change depth and pressure. More lubricant equals more sensation with less friction. And slower thrust cycles: think 3 slow strokes to 1 deeper stroke, often produce stronger arousal for both partners. None of this requires changing size, only changing strategy. When worry crosses the line into distress, if you avoid intimacy, measure compulsively, or feel persistent shame despite normal measurements, you may be dealing with appearance anxiety or body dysmorphic thoughts. You're not broken, and you're not alone. A brief consult with a therapist who understands men's health can be life-changing, often in just a few sessions. The goal isn't to convince you that nothing matters, it's to align perception with reality so you can enjoy the body you have. Medical check-ins worth doing after 50: blood pressure, fasting glucose A1C, lipids, thyroid, and a medication review. Common culprits that can blunt sexual performance include certain antihypertensives, SSRIs, and excessive alcohol. Don't stop meds on your own. Talk with your clinician about options with fewer sexual side effects or about timing doses to minimize impact. Hydration and salt balance matter more than you think. Mild dehydration thickens blood and can reduce vascular responsiveness. Aim for pale yellow urine most days. On the flip side, very high sodium diets may worsen blood pressure and endothelial function in some men. Simple swaps, salt-free seasoning, potassium-rich fruits and veggies can help. Warmth for better measurements: a warm shower or heating pad across the inner thighs encourages vasodilation, giving you a more representative flaccid and stretched length. Cold rooms and stress hormones do the opposite. Don't let a chilly bathroom sabotage your data. Last, a word about privacy and perspective. Your measurements are for you and your clinician, not a group chat. Treat this like any other health metric: useful, not defining. And remember to breathe, literally. Slow exhales cue your nervous system to relax, which can improve rigidity and control in the moment. If you've made it this far, you're the kind of man who invests in himself. Share this video with a trusted friend who needs a straight talk guide, and consider sponsoring the channel to help keep the lights on. Your support funds clear audio, better visuals, and the research time required to bring you practical, judgment-free education. Let's look at procedures with a cool head so you can separate marketing from medicine. Girth-focused options. The most discussed cosmetic approach today is temporary filler placed under the penile skin to increase circumference. Hyaluronic acid fillers, similar to those used in facial aesthetics, are absorbable over time and, Inexperienced hands can add a modest 2-3 cm of girth. Results vary and typically last 12 to 18 months. Downsides include cost, unevenness, nodules, and the need for maintenance. What to avoid: non-absorbable materials such as industrial silicone or permanent microsphere fillers, often marketed as low maintenance. These can trigger chronic inflammation, hard lumps, migration, and tissue damage that is difficult or impossible to reverse. Reputable clinicians are upfront about these risks and stick to materials your body can resorb. Length-focused options. Two things get advertised most: liposuction of the pubic pad and release of the suspensory ligament. Lipo does not change your penis. It simply reduces padding that hides the base, revealing more of what was already there. The ligament release surgery can make the flaccid penis hang lower and may add a small amount of visible length when soft, but it does not increase erect length, and it may reduce stability during intercourse. Scar tissue, asymmetry, and dissatisfaction are not rare. Most professional bodies advise strong caution and clear, realistic counseling before considering it. Devices. Extenders and vacuum erection devices are sometimes used medically for Peyronie's disease or after prostate surgery to preserve length. Evidence for true length increase in healthy men is mixed. If you experiment, do so gently, follow manufacturer guidance, and stop with any pain, numbness, or discoloration. More traction is not always better. Your take-home plan. Measure once, measure right, bone-pressed length on top, mid-shaft girth, erect values for comparison. Train the system, brisk walks, simple strength work, and 3 to 5 minutes of daily pelvic floor practice. Guard the vessels, control blood pressure, glucose and lipids, don't smoke, moderate alcohol. Prime the moment, warmth, slow breathing, generous foreplay, and clear communication. Feed the system, plenty of plants, nitrate-rich veggies, adequate protein, hydration, and sleep. If this guide helped, please like the video so YouTube shows it to more men who need facts over fear. Subscribe for upcoming deep dives, curvature, morning erections, and smart ways to talk with your physician. And if you want to keep this content ad-light and independent, consider sponsoring the channel or sending a small one-time thanks. Every bit goes to production, research, and bringing calm, evidence-based guidance to men over 50. Final reassurance: you are not your numbers. You're a whole person with a story, a partner, a future. Focus on what you can control today and enjoy the wins that come with it. Disclaimer: I'm an AI urology educator drawing on reputable open sources. This video is for informational and educational purposes only and is not medical advice. Do not start, stop, or change any treatment based on this content. Before you try any exercise, device, supplement, or procedure, consult your clinician or a licensed urologist who knows your personal history and medications.